If you want to know if dialysis or hemofiltration is necessary for sepsis when a critically ill patient is in intensive care, stay tuned. I've got news for you. We get this question quite frequently, if dialysis or hemofiltration is always necessary for a critically ill patient in ICU with sepsis or septic shock. So dialysis or hemofiltration is not always necessary for sepsis, but it may be required in some cases, particularly when the sepsis leads to kidney dysfunction or kidney failure. Sepsis can cause a severe inflammatory response that can damage organs, including the kidneys, leading to acute kidney injury, also known as AKI. If kidney function deteriorates significantly, dialysis may be needed to help filter waste and maintain fluid balance in the body. Now, other reasons why dialysis might be needed or hemofiltration might be needed and the kidneys go into AKI, acute kidney failure, is simply sepsis is often leading to hypotension, i.e. low blood pressure. And if there's low blood pressure in critically ill patients in intensive care during sepsis, get started on inotropes or vasopressors, that might also hit the kidneys, and hemofiltration or dialysis is needed. Generally speaking, the treatment for sepsis focuses on antibiotics to address the underlying infection, fluid resuscitation to maintain blood pressure and organ perfusion, supportive care for any affected organs, including the kidneys. If kidney failure occurs, dialysis, either hemodialysis or continuous renal replacement therapy like hemofiltration, may be needed temporarily until the kidneys recover or until the infection is controlled. However, not all septic patients will need dialysis, but I can tell you from experience, after having worked in critical care nursing for 25 years in 3 different countries, where I worked as a nurse manager for over 5 years, and where I've been consulting and advocating for families in intensive care since 2013. And I can very confidently say we have saved many lives with our consulting and advocacy. And you can verify that on our testimonial section at intensivecarehotline.com. And you can verify it on our intensivecarehotline.com podcast section, where you can listen to interviews with our clients and what they say. But I can confidently say that many patients with sepsis in ICU do need hemodialysis or hemofiltration. Now, we have helped hundreds of members and clients over the years with intensivecarehotline.com consulting and advocacy for families in intensive care when they have a loved one critically ill in intensive care. Like I said, you can verify the results that we are getting for our clients on our testimonial section at intensivecarehotline.com, or you can verify it on our intensivecarehotline.com podcast section where we've done client interviews. And with us helping hundreds and hundreds of members and clients over the years, that's why I also do some one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp. That's where you can get most results when I, give you the proven strategies or my proven strategies. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you simply can't afford to get wrong. I also talk to doctors and nurses directly. And when I talk to doctors and nurses directly with you or on your behalf, I ask all the questions you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. And I hold them accountable once again for getting the right results, making sure your loved one gets best care and treatment always, so that you can make informed decisions, have peace of mind, control, power, and influence. I also represent you in family meetings with intensive care teams. We also have created a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecarehotline.com and click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email. And we answer all questions intensive care related. In the membership, you also have exclusive access to 21 ebooks and 21 videos that I've personally written and recorded, sharing all my 2.5 decades worth of ICU and intensive care nursing experience with you once again, so that you can make informed decisions. You have peace of mind, control, power, and influence, making sure your loved one gets best care and treatment. And we're also reviewing medical records in real time so that you can get a second opinion in real time. We're also reviewing medical records after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or simply send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have from this video, and share the video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notification for the YouTube live if you're a subscriber to my email newsletter at intensivecarehotline.com, or if you are a subscriber to my YouTube channel. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.